Our lead story tonight is the new American debate about something Canadian, guaranteed cradle-to-grave nationalized health care for all. The political push toward reforming the U.S. system has led some to advocate adoption of the Canadian approach. President Bush is among those opposed. Here is the way he laid out the choices in his State of the Union address.
Really, there are only two options, and we can move toward a nationalized system which will restrict patient choice, a system which will restrict patient choice in picking a doctor and force the government to ration services arbitrarily. And what we'll get is patients in long lines, indifferent service, and a huge new tax burden. Or we can reform our own private health care system, which still gives us, for all its flaws, the best quality health care in the world. Well,
the debate about the Canadian system has continued since that speech, and we continue it now at a government-to-government level. Gail Walensky is Deputy Assistant to President Bush for Policy Development. She advises Mr. Bush on health policy. She served earlier as Administrator of the Healthcare Financing Administration, the federal agency which runs the Medicare and Medicaid programs. Bob Rae is the Premier of Ontario, Canada. Mr. Rae, like the Premiers of Canada's other provinces, is responsible for overseeing the local administration of Canada's national health care system, of which he is a strong advocate. He is with us tonight from Toronto. Mr. Rae, you answered President Bush and other Americans in a recent Washington Post op-ed page, quote, "I'm glad we have our system and not yours," end quote, you said. Why are you so glad, sir?
Well, because the things that President Bush said in his speech about how our system runs, I can't speak for other countries. I don't know what other systems he had in mind, but in Canada, patients have the right to choose their own doctors and do. They have that right is fully established and clearly established and has not been changed at all by the way in which we've changed our insurance plan. Because we're able to provide insurance for literally for everyone, that it is paid for out of tax dollars at the provincial level. And on the whole, it's a system that is more affordable for our society, more affordable for our economy, and provides a better quality of care than any of the alternatives that we've seen. And the picture that President Bush describes, or Senator Tsongas, who's commented on our system, when they talk about our system, I simply don't recognize what we experience here. It's not a perfect system, but we think it's a good one, and we think that if you want to study it, that's fine. If you want to choose another system, that's fine too, but don't knock the system here because we think it's a good one, and we think many of the criticisms that we've seen in the American political debate are just really quite off base.
Well, I want to go through those, but in your op-ed piece, you made the major point that you made was that comparing your system with the American system was that your system, the Canadian system, was fairer. What did you mean?
Well, quite simply, we don't have, I think in your country there's something like 40 million people estimated for 91 who don't have any insurance at all, another 50 million people who are substantially underinsured. In our system, everyone is insured, everyone is covered. People get to choose their doctor, and the care is provided. It's paid for out of tax dollars. The system ensures that what determines whether or not you get care and when you get care is how sick you are, not how well off you are or how well connected you are or what kind of insurance you have. Everybody has the basic insurance. Now, you can supplement that insurance, but the basic insurance is there for everyone, and I think that's the fairest system. What we've said as a society, and we said it a long time ago, and there's nobody on the right or the left or in the middle or wherever in the political spectrum I think would want to move away from it. What we've said is that health care is simply not a commodity. It's a basic right. It's a sign of what we owe each other as human beings. Anybody can get sick, whether they're rich or poor, and everybody should have access to decent health care. And we've managed to do that, and we've managed to do it in a way that's we think, reasonably cost-effective, reasonably fair. Of course, there are going to be problems in any system, but we're very proud of our system.
Ms. Walensky, has Mr. Rae not actually framed the differences between the United States and Canada when he says that in Canada, health care is a right, where in the United States it is not seen as a right?
I don't think that's the most useful way to look at it. Let me explain why. I think that Americans believe that people need to get access to adequate health care. The question is who, how, who pays, how is it provided? That's really a very complicated question. I think that it's important for Americans to recognize that if Canada is satisfied with the Canadian system, that's their business. I look at what Canada does and I feel very strongly this is not going to work for us. We are not them. We have a different cultural background. We have different views toward government. We have different expectations. And I don't think that what they have done through their entirely tax-financed system, which has much greater constraints on technology and availability of specialists, is something that we in this country would find comfort with. If it works for them, I'm not going to tell them they ought to change. I do think that they are beginning and will continue to see some fraying at the edges. It's 20 years out. Some of their capital structure is going to start to show signs of wear and tear. And of course, their baby boomer generation is just beginning to hit their own country. But again, if it's for them, that's their business.
But let's go to some of the basic underpinnings of that system and as how it applies to the debate that's going on in the United States, the political debate. And it's not only a political debate, I think you would agree, it's a debate that's going on not only among the politicians, but among everybody in the country. Now, the question that I raised and that he raised was the issue of the right. In other words, in Canada, the decision has been made by society that everybody has a right to health care across the board. Now, that decision has not been made in the United States. Is that correct?
Well, in the sense of, does the government guarantee that you will have insurance or that you will have coverage? No, we certainly have not made that kind of decision. What we have said, and what President Bush has announced, is that the government ought to make sure that poor people have access to insurance and that the barriers that exist that keep the rest of us from sometimes getting insurance or knowing we'll have it have to be broken down. But our whole concept of a public-private partnership is a very fundamental way we look at social services. Canada has no private universities. The whole notion of wiping out private higher education, doing away with that public-private partnership, would, I think, strike people as being very strange indeed. It really is a very different view. What's the role of government? How do we best respond to the needs of our citizens? I think there are very few people who would want government controlling 12% of our gross national product and everything that means in terms of responsiveness.
Well, Mr. Ray, isn't she right that before you get to health care specifically, you have to take one step backward to the political philosophy that guides your country vis-a-vis what guides this country?
Well, I think the issue is one of values in part, but it's also one, frankly, of information. I mean, there's a number of things which Ms. Walensky has said about our system, which you know, I appreciate the comments that she's made. I could make equally strong comments with respect to the American system. She says our system may be fraying after 20 years. I don't think your system is fraying. I think your system is falling apart. I think when you've got 90 million people who either don't have any insurance or are dramatically underinsured, you're the only industrialized country in the Western world that's in such a situation. It may be that the country that's out of step with what's going on in the rest of the world is the United States and not everyone else.
Let's let Ms. Walensky respond.
Let me just say one thing. We accept a public-private partnership. That's essential. The argument, for example, that President Bush makes that in what he calls a nationalized system, the only thing that's been made public in our system effectively is the system of insurance. We have one insurer in every province. We've dramatically reduced the administrative costs of the system. Our administrative costs, our bureaucratic costs, the cost of bureaucracy, which I would have thought would be of interest to Americans, is about 25% per capita of what your costs are. That's where the savings come in. But all the other stuff about how Canadians can't choose their own doctor, or how we don't have access to technology, or how people die waiting for operations, this is cliche-ridden stuff. It does not describe the system that I think most Canadians understand and see instinctively and see happening all around us.
Ms. Walensky, have you got his system wrong?
There are a lot of points he just raised. Let me say first, the 90 million is a number I think most of us would not accept. There are some 30+ million people without health insurance coverage. What counts for underinsured is very much in the eye of the beholder. We recognize in this country that having large numbers of people without health insurance coverage is a problem. The President has stepped forward with a plan to resolve that. Others have as well. And we recognize that our costs are increasing too fast. The good news for us is that we couldn't have designed a system to spend more money than the one we've got that gives us lots of place to look to try to get a handle on healthcare cost increases without going to a system which for us would be very uncomfortable, that is government single payer. Now the issue about whether we're the ones out of step, they're the ones out of step, Canada is frequently cited as being very much in line with other European countries. In fact, it is one of the few countries that does not have a place for private insurance. I'm not going to say that's wrong for them, but it actually is not very moderate with them.
Excuse me, Ms. Walensky, that just isn't the case. You've just said something which isn't true. You've just said that there's no room for private insurance in the Canadian system. There are hundreds of thousands, indeed I would suspect millions of Canadians who have supplemental insurance of various kinds. So that, again, let's get the facts straight. Now the room for private insurance may not be as big as you or others would like it, but to go around telling Americans that Canadians can't choose their own doctor, that there's no room for people having additional insurance, the other stuff that's being said is really quite unfair. And it's almost as if we're being forced into the debate in the United States because, I mean, Senator Tsonga said, for example, he said if he'd been ill in Canada, he wouldn't have been able to get the same treatment. False. The treatment has been in place in Canada for as long as it's been in place in the United States. I was a bone marrow donor myself, I mean, for my own brother. So the stuff that's being said about our system, I think is becoming, putting at issue, really, why it is that so much about the Canadian healthcare system is being misunderstood and misinterpreted in the middle of this political debate in the United States.
Let's give Ms. Walensky an opportunity to describe what she believes the Canadian health system is and why it wouldn't work here.
Fundamental decisions are made at a governmental level. It is government-financed healthcare in this country that carries with a very large connotation. Decisions about technologies are made at the provincial level. They are done through global budgets.
So many, whatever, CAT scan machines and that sort of thing.
Lithotripters, the kidney stone smashers, magnetic resonance imagers, the MRIs, the latest in imaging. These devices are rationed, allocated in a very careful way as a way to try to control healthcare costs. They're much less available. People are expected to travel to university sites to have them in very controlled ways. The number of specialists are much more controlled than they are in the United States, and they're controlled in much more of a government-oriented fashion. For us to look to this kind of a system where government makes the decisions about how much and how to allocate it and raise the money to finance healthcare through taxes would be a very foreign concept. There's a wonderful quote that was on the PBS show about 2 weeks ago on critical condition, where a man from Flint said, "I'm for national health insurance. I just want to keep the government out of it." Now that's not the kind of comment that you hear in Canada. And again, I am not telling Canada that this is not a good system for them. I do believe very strongly our way of doing things, our view of government, our views about the role of government, and our inclinations toward availability of modern technologies in an easy way is a very important distinction.
Let me ask you this. There are many ways to measure quality of health care. One of those that Mr. Race cited in his op-ed piece and that I read today, those who advocate a Canadian system for here point out that two of the measurements are infant mortality and longevity of life. And in both of those categories, Canada outranks the United States.
I think, frankly, you know better. I think that you know that both infant mortality and life expectancy are heavily influenced by lifestyle factors. Our problems are much more to do with drugs and alcohol abuse, not taking proper care. You need medical care. There are instances where medical care makes the difference of life and death, but we know that these factors are much more heavily influenced.
All right, then what measurements would you use? In other words, how would you judge, and what basis would you use to judge the differences between the quality, the health care that the average Canadian gets vis-a-vis the quality that the average American gets?
Well, I think that what we are trying to do in this country, and it's something this country has been a leader on, is look to outcome measurements, look to what really makes a difference, as well as, of course, how people function, how well they're functioning, the whole sense of well-being. Very little of medical care at any point in time really is distinguishing between life and death. It has a lot to do with quality of life, how well we function, the sense of well-being that we have in our system. Those factors, of course, are driving in part our interest in reform. We know that we've got to make changes. I don't want to sound like our healthcare system now is everything it should be. We know that's not true. But on areas like quality and easy accessibility and comfort, we do have very strong measures and leaders in research and development and training, pharmaceutical research, areas in which not only we gain a lot, but of course the rest of the world gets to gain with us.
Mr. Ray, what measurements would you use to judge the differences in the health care quality that the average Canadian, average American gets?
Well, I do happen to think that basic criteria like how long you live and how many children survive and so on, I think those are basic factors. Those are basic measurements that are used by the World Health Organization and everyone else. I don't disagree with Ms. Walensky when she says that there are a lot of other factors. Of course there are, but let's not redefine the problem or redefine the issue. And I think those are critical criteria that you've got to use. I also just want to take issue because Ms. Walensky keeps coming back to this specter, which I know is such a feature of American politics, of the government running everything. The reality in our system is that what drives the healthcare system is the relationship between patients and doctors. That's as true of our system as it's true of the system in the United States.
Let's stop right there. Are you suggesting something different than what he has said about the Canadian system? Do you think it works differently than what he just said?
Well, I think that the issue of whether the most important relationship is patient and physician is, of course, true. The question of whether or not government makes fundamental allocation decisions about where technologies, facilities, and specialists are available is something that characterizes Canada, doesn't characterize.
But every
right,
system, but I guess my disagreement with Ms. Walensky is that I think she's forgetting the fact that every system makes a decision about priorities. This argument somehow that Canada is a system in which the government runs everything, which is false. That just isn't true. And then to say that there's no rationing in the United States or that there's no allocation going on in the United States, of course there is. It's just that it's being done in a different way, and it's being done in a way that isn't as clear to everyone. Yes, some priorities are established, but to argue from that to say that somehow people don't have access to care or that there's a denial of access to care is, again, it's simply not true. And I think that this is what makes the debate for us such a real one. When the President of the United States goes on the State of the Union address and says that if you have a system which is different from the American system, and he uses the cliche of a nationalized system, and then says patients can't choose their doctors, I mean, you've got millions of Canadians watching that and just saying, is he talking about us? Because if he is, hey, it's not the system we understand.
He was talking about Canada, wasn't he?
Well, he's talking about, I think at that point, generically nationalized systems, including Western Europe as well as Canada.
I just don't think it's fair to Canadians. Sorry.
Yeah, I hear you. But in response to Mr. Ray, what you're saying is that you're not denying that there is rationing of health care in the United States, right?
Well, I think the
you're
issue...
You're just upset about who makes the decision.
The point I think that's important is who makes these decisions. Yep. In Canada, with regard to facilities, institutions, technology, specialists, it is government. Now, that is a form of doing it. I know more about government making decisions or issues of that nature, having just come from being the administrator for Medicare and Medicaid, than many people in the United States. I think for us, that is not where we want those decisions being made. It is an option. Many countries do it. When we talk about rationing, what we usually mean is not providing services that we believe can have medical benefits associated with them. Of course, we have to make resource allocation decisions.
And that's rationing.
Rationing is when you don't...
Right.
Well, what I think we think of the United States as rationing is not providing medical services that can have medical benefits because they're too low a priority. Right now, we have a medical care system in the United States where everything drives us and the providers of health care to want more, consume more, and provide more. We have so many places where we can move to try to change those dynamics, before we are to do something like explicitly not have services that provide medical benefits, what other people can call rationing. Do we make choices? Do we make resource allocations? Of course, we make resource allocation decisions.
Well, in that case, so do we. I mean, I just say, if you're going to play those word games, Ms. Walensky, then I would just say to you, that's exactly what happens in our system as well. And to argue that somehow it's the government alone acting in some sort of a vacuum which simply determines these things, when in fact the evidence is overwhelming in our own system that it's the choices of patients and of doctors working within the context of what is affordable. Obviously, no society exists without limits. The insurance companies, the private insurance companies in the States make those decisions all the time.
And no television show exists without limits either. So we have to go. Premier Ray, thank you for joining this debate
thank you very
tonight
much.
in Toronto. Ms. Walensky, thank you here in Washington.
You're very welcome.